What is the first step in donning PPE before entering the patient's room? If you want to don PPE, what's the first step? A. Put on gloves. B. Put on gown. C. Perform hand hygiene. D. Put on a mask. What is the first step in donning PPE before entering the patient's room? Will you put on the glove first? Will you put on the gown first? Will you perform hand hygiene? Or you put on the mask? What's your answer? What's your answer? I want to see your answer. Do you go for A, for B, for C? Good. Melvin says, perform hand hygiene. Perform hand hygiene. Remember that we said hand hygiene is the first and most important step in donning PPE. Okay? The first and most important steps. Of course, putting on gloves is important, putting on a gown is important, putting on a mask is important. But the first step, if you want to put on PPE, is to wear or to wash or to perform hand hygiene. Next question. David is a 9-year-old boy who is diagnosed with chickenpox. What type of room should David be placed in? David, a 9-year-old, is diagnosed with chickenpox. What type of room should David be placed in? A. Standard private room. B. Shared room with patient with influenza. C. Negative pressure room. D. Positive pressure. Chickenpox. Where will you put the patient? Standard private room. A. Shared room with a patient with influenza. B. C. Negative pressure room. Or D. Positive pressure room. What is your answer?